On the antisocial disorder spectrum, psychopaths are on the severe end of the spectrum. From up until 4 years old, they tend to form an insecure attachment style with their primary caretaker. Security of early attachment between an infant and his or her caregiver predicts not just how emotionally well-adjusted she turns out as an adult and how she securely forms attachments to others, but also predicts their moral development. Moral development and empathy are not one and the same thing, because it is possible to develop a strong moral code even in the absence of empathy. Those with insecure attachments have a higher rate of social difficulties, including antisocial, violent, or aggressive behavior, and later in life, a higher risk of divorce in adulthood. Although psychopaths are born and not made, not all of them are violent or aggressive. There are prosocial psychopaths who may show aggressiveness in the form of being highly competitive and manipulative, but have been able to curb self-serving behavior and aid society in some way. Not out of kindness, but out of pride and for power. An example of such a figure is James Fallon, a neuroscientist who found out his brain structure had the same structure of serial killers' psychopathological brain structure. He wrote about his brain scan findings and his family lineage of 7 murderers in his new book, The Psychopath Inside. Although Fallon has low empathy and a propensity towards aggression because of his passed down genes, he was able to roughly keep within societal bounds due to having been born into a highly loving, affectionate, and supportive family. In this situation, nurture trumped nature. Low IQ and low socioeconomic status increases a person's risk of developing antisocial behavior. They do not learn how to fear punishment. There are many fear pathways in the brain, and that also plays a key role in the experience of fear. Psychopaths show less of a startle reflex, an automatic jump to a loud sound or to an object. There is abnormality occurring within the empathy circuitry in the frontal lobes. Patients with damage in the VMPFC show reduced heart rate arousal to emotionally distressing stimuli and also continue to gamble on tasks even when they are no longer winning and being rewarded. They have difficulty feeling emotions like embarrassment and guilt to regulate their social behavior. But the existence of people who have zero cognitive and affective empathy and who have not suffered neglect, paralleled with the existence of those who have suffered neglect but who have excellent empathy, shows that such environmental factors may be neither necessary nor sufficient to cause 0 degrees of empathy. Even though parental behavior can be to blame, it cannot entirely explain the making of a psychopath, because psychopaths' parental style does not completely predict outcome. Psychopaths are mainly born into no empathy due to their brain not being fully developed, while in contrast, sociopaths' personality development is primarily shaped by trauma or abuse in childhood.